Okay, thanks very much, and it's a pleasure to be here. As the final speaker, my job is to provide you with some context for what I'm going to talk about, which is not about actually running a survey. But I will offer some reflections on the surveys presented, particularly the Nous survey, and I'll conclude by elaborating what consumers expect from primary health care, consumer-centred care or people-centred care. So first, a personal story. When my mother first came to Australia as a 6-year-old Italian girl, she and her family were confronted with hostility. Why? Because Italy had been on the wrong side during the Second World War. Italians spoke a foreign language and they ate food that smelt of garlic. How much Australian society has changed since that particularly blinkered post-World War Australia. So how is that relevant? I'd like to ask you a question. How many people in Australia today were born overseas? Does anyone know? Yep.
25%.
Good. Very close. 27%. More than a quarter of the Australian population today was born in a country overseas. How is this relevant to primary health care? You are going to be seeing a lot more people from non-English speaking backgrounds in the future. I've got another question for you. How many people are there in the Australian population aged 65 and over? Don't know? Okay, let me give you some statistics. Our demographics show that we have a rapidly growing ageing population despite the young age of migrants. In 2012, there were 3 million people aged over 69, a 92.2% increase over 2009. Those over 85 years also rapidly increased by 5.2% between 2009 and 2010, now equaling 394,500 very old people. Worth noting also is that in 2011, the first group of baby boomers, myself included, turned 65. I haven't turned 65, I'm a bit younger than that. But we now comprise 14% of the population. Their numbers will swell to 20%. That is 1 in 5 people by 2030. That's not far off. And many will be well into their 80s by then. Most will rely on age pensions or superannuations to fund their healthcare costs. The lower your socioeconomic status, the higher probability you will experience poor health. There's very good evidence to show that. I am surprised to learn that a quarter of Australian children are overweight or obese. Also, more than 40% of 5 to 6-year-olds have untreated decay in their teeth, with a quarter of 12-year-olds with untreated decay in their permanent teeth. As the Nous survey shows, the vast majority, 94% of the Australian population, use primary care services. The Nous survey also shows that confidence levels are high at 85%. About access to quality, safe medical care, medications and medical technologies. But if they fall ill, confidence levels fell the more financially stressed people were. Only 37% of those with high financial stress are confident they can afford care when they need it. Of note in the Nous survey is that this was a consistent trend over 4 years of the survey. Over the last decade, medical and hospital fees have risen 86%. Medical and hospital fees are now ranked third of the 10 highest expenses after house purchases and rent. Australia now has amongst the highest out-of-pocket costs in the world, ranked 5th in the OECD on out-of-pocket costs, with Australians paying per person double the amount of people in the UK and France. 19.3% of Australia's total healthcare costs are now paid directly by consumers as out-of-pocket expenses. In short, close to a fifth of our nation's healthcare costs are funded through out-of-pocket costs. Thousands of Australians are now using superannuation funds to cover medical gaps. Is it such a surprise, as the Menzies Now survey shows, that the majority of financially stressed people are not confident they can afford healthcare when they need it? Also not surprising is that after the need for more doctors and nurses, other health workers, most people wanted to see affordable healthcare and medicines as the areas needing most improvement. The Now survey showed 85% of the half, although one of the surveys was showing that far fewer people than half were seeing nurses in general practice. But those that see nurses in general practice are very, very satisfied with the care they're getting. The healthcare with the lowest satisfaction rate, which Professor Gillespie didn't go into, but I want to raise it because it's relevant to the comments I'm going to make towards the end. The lowest satisfaction rates were with residential aged care. A major finding of the Now survey was that only 54% of those using the services were satisfied. This compares with 72% satisfaction of those receiving community care services at home. As I've said already, by 2030, as many as 1 in 5 people in the population will be aged over 65. This means use of primary care services will significantly increase in the next decade. Many more people will experience multiple chronic conditions. The numbers of older people with dementia will increase significantly from 250,000 to double this number again. The implications for primary health care are clear. More older people wanting value for money primary health and community support services. And that's not talking about the quarter of the population from non-English speaking backgrounds who are on the whole much younger but have high needs in terms of health care. So I just want to highlight this because I think it's pretty staggering. Most people, 64%, a majority of Australians, are willing to pay more tax if it meant people could stay at home. A staggering 91% of Australians wanted more funds available for older people to buy the services they needed to stay at home. These findings strongly suggest that older people want to stay in control of their lives, living independently in the community for as long as possible. The future for primary health care will inevitably involve a focus on providing a range of services to enable families, older people and their carers and communities to care for those with chronic illness. The Royal District Nursing Service, they gave a presentation earlier today, in Victoria already is confronting this rapidly ageing population in Melbourne. What these surveys tell us about primary health care services is that they will need to continue to focus on the range of health and community support needs of people using primary care services. So, what is people-centred care? These are the words of the World Health Organization. So it's a change in health systems and it promises many potential gains. And the benefits spill over to you in terms of satisfaction, patient trust, loyalty, good reputation and a cost-effective and sustainable health system. The gains are are increased patient satisfaction in terms of patient safety, adherence to care plans, improved treatment and health outcomes, increased patient satisfaction with care, improved quality of life for patients and their families in the community. So these World Health Organization principles are underpinned by international law, human rights and dignity, non-discrimination, participation and empowerment, access and equity, and a partnership of equals. So what patient, people-centred care really is about is increasing health literacy of consumers. That is, health literacy is about gaining access to and understanding and using information to promote and maintain good health. It enables people to understand their condition, how best to treat it, how to self-manage the recommended treatment. Now, practice nurses are in the box seat with health literacy, aren't they? Yeah. You are the ones that most people seeing general practice appreciate because you give them time. You're the ones that can do much more health promotion and health prevention work because you're not stuck in this model of this fee-for-service model for care. You're there to do other things which people realise is just as important. Another important component of people-centred care, well, there's health literacy in a bit more detail, is promoting a culture of multidisciplinary care. Now, the New Zealand survey showed that, and I think it was the PSI survey showed also, that how the GP and the nurse works together has a big impact on people's perception of the care they're receiving. But it's broader than that, multidisciplinary care. That's important, sure. But often the GP refers people on, say they've got diabetes and need an eye test. Now, GPs I know tell me that often people won't go and have their eyes tested, and so I ask why, and they say, well, they just don't go. And I wonder if are they worried about the cost of an eye test? Has someone explained to them what bulk billing is? Do they understand what Medicare covers? Particularly if we've got a quarter of the population from not born in Australia, the health system they've come from is going to be very different to this health system. So this is again a role for practice nurses. Practice nurses are really the ones that can explain or talk to, if you've lived and worked in the area for a long time, and a very nice lady I spoke to at lunchtime told me she'd lived and worked in the area for her area for 30 years, and she knew everyone and they knew her. So practice nurses, in those situations can refer people to specialist carers who will bulk bill, because we've seen from these surveys that financial stress is a barrier for people. Okay. Promoting partnerships with individuals, families and communities is very important also. And it's, I guess, the gist of the relationship between the consumer and the practice nurse is that partnership, where the practice nurse is providing people with written information as well as verbal information. I've highlighted the fact that a lot of people now in Australia are born overseas and may not be able to receive information in English, may not be able to participate in the surveys because they're in English. That's a quarter of the population we're not capturing. But there is a lot of health information now in community languages, and this is a key role that the practice nurse can play. We've got someone here and a booth here from the National Prescribing Service. I've worked with the National Prescribing Service since it was born, and they produced languages other than English, 5 languages other than English, Chinese, Vietnamese, Greek and Italian and Arabic. They produce information in those languages which is this information is readily available. It's available here at the NPS store. They also produce this fantastic medicines talk, which is designed for people whose English isn't great, and a lot of people from non-English backgrounds probably could follow this or easily have it translated for them. Now this one is on sleeping tablets, the right solution. Now there's a range of them on every topic, through diabetes through to sedatives and tranquilizers. There's every possible topic any consumer would want to read about. The NPS produces it. And they've got this medicine update too about actual dabigatran for preventing stroke. Now there's a lot of these. They're a bit more complex, but certainly the practice nurses could be using these as well. So my point is that in the future we're going to have to do things very differently in the primary care system in Australia, because we have this very rapidly growing number of people born overseas and their first generation children like myself, who are looking at things through slightly different eyes. We want to look for material that is written. I like reading Italian, so I love this little brochure, Tenere sotto controllo il diabete. These things are important to people from these backgrounds. Language is important, it's part of their cultural heritage, their cultural identity. So we need to get on board and get modern and address that population and address our ageing population. And practice nurses are, I wish they were in every practice in Australia. They are the people to do it. So to conclude, it's partnerships, it's multidisciplinary care, it's health literacy. These are the way of the future for practice nurses in primary health care. Thank you.